So for patients who need to rehabilitate, what is the importance of pain management and physiatry in a rehabilitation facility?
Sure. So from a rehab perspective, we look at sometimes patients two different ways. We look at our short-term patients. We want to alleviate any barrier that we have to make them successful and to get them home. Sometimes it could be a pain issue. Sometimes our patients, they think it's just a way of life because they've lived with it and they don't really know to tell us that that's an issue. So it's taking that time and really having that cohesion with that physiatrist and nursing and rehab to really break down what are those barriers. If we can get pain management in and get those pain management issues, it gives us the opportunity we need. So then we can go in and do our strengthening and support our joints and whatever we need. We just really get really good outcomes when it's managed. There's also, too, it's a lot more complicated because sometimes those medicines have side effects. So there's a component where they're tired or they're unable, or it causes falls. So it really has to be managed very, very carefully because we want, like I said, we want the most ultimate outcomes for them to be able to go home successfully. And with having that physiatrist and having the pain management and having the patient being able to really speak for themselves and tailor and do what we need to do, we have amazing outcomes that way. And I really feel like it's a huge, huge issue. Now, as far as for our long-term patients, just as important, quality of life is everything. We find that people who are in pain or not comfortable or have issues, they tend not to want to get out of bed. It becomes a way of life. If I don't move, I don't hurt. So look at every single long-term care resident with why aren't you up today? Why aren't you going to activities today? Your family came to visit. Did you not want to go out with them? We have outside trips. Did you not want to go? And then peeling back those layers to find out what it is and then identifying if it's something that we can focus on improving. And then again, getting them stronger. Sometimes just getting them to be able to sit up in a wheelchair all day, to go outside and see the sunshine, to visit with friends, to attend that quality of life is just important as someone going home. This is their home. So we want to make sure that they're as pain-free as possible. And again, that tailored, very specialized approach to every individual patient, their needs, their medications, their goals, not our goals, their goals, is really only achieved with that big team approach and looking at every facet of that patient's potential.
So can you share with us some stories, patient stories about how some rehabilitate and how are they able to rehabilitate and how pain management and physiatry allows for that rehabilitation for your team to actually do the work?
Absolutely. I have some wonderful stories I'm happy to share. Let's start with the ones that we didn't think were going to make progress. I had two patients particularly who both had not been out of bed in over a year. No walking, dependent for everything. And when you would go to ask them about getting up, they would kind of mention pain, but it wasn't like you wouldn't think that was a big issue. Well, then as we kind of encouraged it, we started to move them. Pain was absolutely the issue. I had a patient who was getting contracted, her knees wouldn't even bend. I was able again to reach out to my pain management clinic, and they came in and went with me, and we went together and they talked. It was wonderful. They explained the treatment options. For both of these particular patients, they were able to get injections in their knees, and then also they were managing their overall pain, where Tylenol was not enough, but the other medicines were too much, again, which resulted in very sleepy, and which I think had been part of the issue was I think the patient was very sleepy. So patient goals, I had one patient who wanted to go back to her home, even though she hadn't been there in a year. The other patient wanted to go to the community, had not been out in the community in probably closer to a year and a half. So were they realistic? We don't know. So let's see what they could do. So as soon as we started the interventions with the pain management, with nursing and the pain management and the physiatrist and then rehab, we were able to get pain from 9 out of 10 down to 1 out of 10. Both of these patients were able to walk whatever distances they wanted to. Actually, really within 2 to 3 months, they were able to do laundry. They were able to do mobility. They were out in the community. Both were able to discharge home, which again, we think about our long-term care patients. But sometimes if we just look at that individual patient and ask them what they want, we don't know until we look at every avenue of what that barrier is or what their potential is, and it's worth giving everybody a chance. So I didn't think that was going to happen. And there's nothing more thrilling as a therapist to see your patients go home. It was amazing. But had their pain not been managed, that would not have been an option. We had another patient, similar situation, had not been out of bed in over a year, did not have the potential to go home, but wanted to be able to be up more, wanted to be able to go outside, wanted to be engaged in everything. So same thing, we were able to have that consult, and pain management was able to suggest some injections and some medicine to manage that pain. And once we were able to get her up, we got her stronger, some stretching, got her, she is pain-free, no complaints of pain at all. So a lot of times those pain interventions are temporary. I mean, we're really looking at those, and they're adjusted, like I said, how they need it, when they need it. But within probably a month, there was no pain. She is up every day, all day, at all the activities. She sits outside in the sunshine. When family comes to visit, she's able to sit outside with them and visit. She's able to go out if she needs to and come back. She's happy, and I mean thrilled, and every day. And again, that would not have been possible had we not been able to really make that identification. And I know like pain's not a barrier for everybody, but there are other things. But again, we still need to take that one-on-one approach and peel back. Why are they not wanting to get up, or whatever their goal is? This is their home. We want them happy in their home. So what can we do to give them the best quality of life ever? And I think we do a good job here at Relane. We look at our patients quarterly. I'll go to them and say, hey, you've not been up recently, or how are you doing? And really ask just kind of those lifestyle questions. And they'll say something like, well, I miss going to bingo, or, I haven't felt great lately, or because we look at everything. We look at their emotional status, we look at their pain, we look at their goals. We try to find out what motivates them, because again, this is their home, this is their life. So once we identify, let's say I've got a patient, I'll say, let's get up and let's go somewhere. And they're like, and I start to move them, and I start to feel that there's some tension or tightness or pain. That's my first instinct. Okay, so I get with our nursing department to find out what they're on. Does the patient complain to them about pain, or is it just something that I happen to notice today? A lot of times the nursing will say, no, I asked today and they said there's no pain. Well, if someone's laying in bed and they're not moving, there is no pain. So once I show the nurse, well, look, when I go to move this arm or this leg, it's stiff, or it hurts or whatever, then a lot of times we'll go ahead and reach out. If it's something that like a simple Tylenol doesn't quite tackle, or it's just not efficient, we will reach out then to our pain management clinic, and then they will come in and we assess together. So like I personally walk down with the nurse practitioner, and we talk to the resident about what they would like to do, why they're not able to do what they can do. And then instead of just asking the patient how they feel, we move the patient. So I'll say, let's sit up on the edge of the bed, and we're watching, observing. As soon as we start to do that together, we're now seeing the physical signs and symptoms of discomfort or pain. We're seeing them finally vocalize, yeah, when I move, I'm in pain. So, and then we talk about, well, this is what you'd like to do. This is what we could try to do to help. Would you be willing? And I have not had a patient yet that says, no, I don't want you to help me. And then, which is always the great, that makes us happy. So once we've identified that, then we work together as a team with nursing, therapy, the physiatrist, pain management, identifying, again, what's needed at that time. We meet routinely to discuss how the interventions are going. Do we need to adjust something? Is it effective? And then the progress, because we always want to make sure that we're making that progress toward the goal, because that's why they're on therapy or why they're being seen. And then in some cases, like I said, we're able to tailor back the medications. In some cases, they no longer even need pain medication. So then we would continue again, like we do our quarterly screens. I would come back and keep following up that they're maintaining that quality of life. Is there anything else that we need to work on and address? If you took every long-term care patient and you did that kind of a screen every time, really laid your hands on them, really took that time to talk to them, we would find a lot more things that we could really work on their quality of life. And again, this is their home. They deserve the best quality life they can. So it's very effective.
Tell us, if one of our patients is looking for a facility for short-term or long-term rehabilitation care, what should they be looking for in a facility?
So we do a lot of tours, and I get to help a little bit. So this would be my advice. When you come in, ask a lot of questions. I would look to see, does staff look like they're happy and engaged? Do the residents do they look nice? Are they well kept up? Are they engaging and talking? Or you see people out in areas? I would talk to different departments. Like I would go to rehab and I would ask them, like maybe how long their therapists have worked there. Are they familiar with, if it's a short-term patient, are they familiar with a certain diagnosis? How much treatment time? I would ask what features, like our gym at Rehab has a full washer and dryer, full kitchen. We have really nice updated equipment. You don't always have to have that, but again, it just shows the commitment to having what a resource the patient needs. I would ask, I would definitely meet some of the department heads. Most of them have a good business office manager if you need to find out about finances, because that's always everybody's concern. Social services is always able to give a little input about what we offer. We have activities, what activities we do in the facility for the residents. But a lot of it honestly is observation. Walk through your buildings, ask questions. If they're walking around and you're seeing smiling residents, smiling staff, it looks inviting, it looks cheerful, that's a good start. It really does. It gives you a good idea of what, to me, that would be a good idea to look for. Because if you're going to put your loved one there, you've got to be able, and you also want to make sure that if you need to reach out to communicate, that someone's going to return those phone calls. So I highly recommend Florida Spine and Pain, from direct interventions with patients, things that I have witnessed, successes I've seen. But for the biggest part of us is we look at continuum of care with patient care. We want, they're taken care of in a hospital. They come to us as a skilled nursing facility to get as independent as possible, either to stay or to go home. And when they go home, I want someone to continue to take care of them. So if I've got a patient here and they've been following me with my patient with Physiatry and we're managing their pain and they're going home, I know that because they're also in the community, that my patients are going to be able to be looked at as well. We want to keep them out of the hospital. We want to keep them independent at home. I don't want them back here unless we absolutely need to have them back here. And I just feel like that having that really involved care, knowing those residents, knowing what keeps them safe in their home, and again, keeps the pain managed so they're continuing to function. But I would recommend, and I just recommended actually them to an outpatient that I have, because I have complete faith that they will do what the patient needs ethically and the best care that they can have.